Greetings. I am Tony Bowman, president of the New Jersey Academy of Nutrition and Dietetics. As COVID-19 has impacted New Jersey, many professions have been instrumental to the success of continuing to beat this invisible enemy. New Jersey dietitians are one of many heroes that have worked on the front lines during this tragic time. The New Jersey Academy of Nutrition and Dietetics would like to thank some of its many heroes.
Elaine, MS, RDN, LDN, board-certified diabetes care and education specialist, and certified lead therapist. I work as the lead dietitian at Jefferson Health, New Jersey, Cherry Hill Division. During this time, besides prescribing tube feedings, we educated the nursing and medical staff on Aspen guidelines, including feeding patients when they were in a prone position. I think that this pandemic has been a great opportunity for our profession to demonstrate just how essential nutrition is to the critical care team and our patients.
Hello, my name is Jillian Cesarini. I work as an outpatient registered dietitian for Virtual Health out of Camden, New Jersey. Specifically work under the Healthy Food Access Programs and Virtual Mobile Farmers Market. During the pandemic, we've been out there helping the communities of Camden and Burlington County by providing free pre-made bags of produce and non-perishable goods. I feel really grateful to be a part of such an awesome team and have the opportunity to help people during this time.
My name is Anisha Chibber, MSRDN CNSC, and I work at Morristown Medical Center as a critical care dietitian. The past few months have been very challenging at the hospital, just like many other healthcare organizations. In order to preserve PPE, we moved to the remote charting system, which meant we were unable to interview patients in person or speak with family members who weren't allowed to come to the hospital and coordinate care with other healthcare team members. What it now involved was calling families and caregivers of patients, especially the ones who were intubated, coordinating care with nurses by calling them more frequently, texting residents and emailing physicians regarding the adjustment of the nutrition support of patients that was changing more frequently because of the clinical condition that changed more rapidly. While I was working at the hospital, at home, I was part of webinars, podcasts, and enrolled in many social media platforms, read publications to make sure that I was up to date with the medical and clinical management of this patient population. This has been a valuable and lifelong learning experience and has prepared me to deal with similar situations more efficiently in the future.
We are the clinical dietitians of Monmouth Medical Center in Long Branch, New Jersey. We cared for the sickest patients during the COVID-19 crisis. Some say we are heroes, but nothing we did was heroic. We just did our jobs as champions of nutrition. We adjusted workflows to ensure patient and staff safety. We worked with our materials management department and suppliers to ensure we had enteral formula and feeding kits to provide key nutrients. We attended webinars, read journal articles, and networked with colleagues to establish a nutrition protocol that would enhance recovery by providing adequate calories, protein, and micronutrients. When we began to run short on feeding pumps, we learned how to administer gravity drip feeds. Many of us became critical care dietitians seemingly overnight. We participated in daily interdisciplinary rounds and managed tube feeding regimens to optimize nutrient intake in response to changes in clinical status. We peered through windows to get a look at what our patients were eating and to see if they were experiencing muscle or weight loss despite our best efforts to adequately meet their increased metabolic needs. We rallied together to support each other as our personal lives were impacted by the changing world caused by the stay-at-home order. We felt optimistic with each small victory and defeated with each setback our patients experienced while fighting this virus. We celebrated, cheered, and even cried each time Fight Song by Rachel Platten was played in honor of a patient being liberated from the ventilator and when it was time to finally go home. We were inspired and motivated by the support of the community, which reminded us that we too have a little fight left in us.